So, if you're dealing with peripheral artery disease or PAD, you probably know this story all too well. The lights go out, you get into bed, and that's when the leg pain, the cramping, and that burning feeling decide to really kick in. But what if a lot of that relief wasn't in a pill, but maybe in a pillow? Okay, let's get right into this. We're going to explore the simple but super powerful connection between how you sleep and that nighttime leg pain. Right, so what's the deal? Why does just lying down seem to make everything so much worse? Well, think about it. During the day, you're up and about, your leg muscles are working, and they're actually helping pump blood through your body. But at night, when you're still, everything slows down. Your heart rate drops, your blood pressure drops, and so does your circulation. Now, if your arteries are already narrowed from PAD, that slowdown means your legs just aren't getting the oxygen-rich blood they desperately need. And that's what triggers all that pain. And this is just a perfect way to picture the problem. Imagine your arteries are these big, bustling superhighways for your blood. Well, with PAD, plaque buildup creates these constant construction zones, narrowing the lanes down to a crawl. So that traffic, that vital oxygenated blood, it gets all backed up and it really struggles to get where it needs to go, especially to the places further away, like your feet and your toes. Okay, now this is where it gets really, really interesting, because we're about to bust a major myth. I am sure you've heard this a million times. Oh, your legs hurt? Just prop them up. But here's the thing. For PAD, that common advice can actually be a trap. And this is what we call the circulation paradox. Okay, so check this out. On one side, you've got venous issues, like varicose veins. For that, the problem is getting the old oxygen-depleted blood back up to the heart. So elevating your legs, it's great advice. Gravity is your best friend. But, and this is so important for anyone with severe PAD, your problem is arterial. It's about getting fresh, oxygen-rich blood down to your feet. So when you elevate your legs, you're actually forcing your heart to pump that blood uphill, against gravity, through arteries that are already narrow. All of a sudden, gravity becomes the enemy. And this clinical explanation just nails it. Distal perfusion is just a fancy way of saying blood flow to the ends of your limbs, your hands and feet. And ischemic rest pain, well, that's the official name for that horrible pain you get from a lack of oxygen when you're just trying to sleep. The big takeaway here is this. If you have severe PAD, propping your legs way up can actually cause the very pain you're trying to escape. So, if just throwing your legs up on a pile of pillows is out, what's in? Let's talk about how we can make gravity our ally again. This is all about finding the best sleeping positions to help your circulation, not hurt it, so you can finally get some sleep. Okay, so what's the solution? Well, for those with mild to moderate PAD, or really anyone who's dealing with a lot of swelling, the number one best position is actually a very specific type of gentle elevation. And I really have to stress the word gentle. We're not talking about propping your legs high up against the headboard here. It's all about using a supportive wedge or pillow to create just a slight angle, which helps gravity without making your heart work overtime. And here is exactly how you do it right. You're going to lie on your back, and you'll want to use 1 or 2 pillows, or even better, a wedge pillow if you have one, to get about 6 to 12 inches of lift. But look at step 4, because this is the real game changer. Keep your knees slightly bent. If you lock your legs out straight, you can put a lot of strain on your hips and lower back. That little bend keeps things comfy and effective. Now, if you just can't do back sleeping, don't worry. If you're a side sleeper, you're in luck because that's the next best thing. Sleeping on your left side specifically is often recommended because it can help take some pressure off your heart. But the key, the absolute must-do, is to stick a pillow between your knees. This does 2 amazing things at once. First, it keeps your spine aligned so you don't wake up with a sore back. And second, it stops your top leg from squishing the blood vessels in your bottom leg. All right, we've gone over the do's, so now it is time for the definite don'ts. These are the positions that are actively working against your circulation and can turn a pretty tough night into a truly miserable one. Okay, let's just quickly run through these. Stomach sleeping, it's a huge no. It twists up your spine and puts all sorts of pressure on your arteries. Crossing your legs or curling up into a super tight ball, well, that's basically like putting a kink in a garden hose. You're physically pinching off that blood flow. And finally, here's one you might not think about. A really cold room. Cold makes your blood vessels tighten up, which is the absolute last thing you need. So yeah, grab some warm socks. And this chart just lays it all out perfectly. The main thing to remember is that for those mild to moderate cases, that gentle, supported elevation gets 5 stars. If that's not for you, side sleeping with that pillow between your knees is a fantastic 4-star option. The one position you absolutely want to avoid at all costs, stomach sleeping. Big red X. You know, getting a good night's sleep with pad isn't just about what you do for those 8 hours you're actually in bed. It's also about what you do in the few hours leading up to it. So let's look at some really simple habits that can set you up for a much better night. Think of this as your pre-sleep checklist for happy circulation. A nice warm foot soak before bed, fantastic for getting blood moving. A few minutes of light leg stretches can work wonders for cramping. We already talked about warm socks, and these last two are huge. Nicotine and caffeine literally tighten your arteries, so cutting them out in the evening can make a massive difference. And of course, staying hydrated all day long helps keep your blood flowing smoothly. Now, all these tips, the positioning, the lifestyle changes, they can provide incredible relief. But, and this is so important, you have to know when managing it on your own just isn't enough. Your body will give you warning signs, and it's absolutely critical that you listen to them. Please pay very close attention to these red flags. If your leg pain becomes constant, if it's severe even when you're just resting, if you start seeing changes in the color of your skin, like it's looking pale or even bluish, or if you have little sores on your feet that just refuse to heal, these are all signs the disease could be progressing. This is your cue to see a doctor. Getting treatment early is the key to preventing serious problems, so please do not ignore these signs. So, we've gone through the science, the paradox of elevation, and all the practical steps. And really, it all boils down to this one simple, powerful question. Just by understanding how to work with gravity instead of fighting against it, you have the power to make a real, tangible difference in how you feel, starting tonight. So, why not give it a try?